Your doctor often talks about carbs meds or monitoring your blood sugar, but there's something they rarely talk about. Vitamins, these essential nutrients, fuel your metabolism, support insulin function, protect your nerves, and prevent complications, the real problem most. Diabetics are running low on key vitamins, and they don't even know it. Today, I'll break down the top 4 vitamins every diabetic needs if you're constantly exhausted dealing with nerve pain or struggling to keep your blood sugar in A1C. And check this video could make a huge difference. Stick around because I'll also show you the best foods and supplements to fix these deficiencies fast. Let's begin with number 1, vitamin A. Vitamin A deficiency is a hidden problem for diabetics, and it's not just about diet. High blood sugar and chronic inflammation disrupt vitamin A metabolism, impairing its conversion into its active form, retinoic acid. Insulin resistance blocks vitamin A's role in pancreatic beta cell function, reducing insulin secretion and worsening blood sugar control. Kidney disease accelerates vitamin A loss since damaged kidneys can't regulate its levels properly. Fat malabsorption issues common in diabetics with gut problems. Further reduce vitamin A uptake as it's a fat soluble vitamin that needs healthy bile and digestion to be absorbed. Some diabetic medications, including Orit and Chamine, also interfere with absorption. Deficiency symptoms creep up slowly. Fertility drops since vitamin A is essential for sperm production, egg development, and embryo implantation. Low levels increase miscarriage risk. Libido declines because vitamin A supports testosterone production and reproductive tissue health. Nerves become more vulnerable, worsening diabetic neuropathy and nerve regeneration problems. The kidneys struggle since vitamin A protects against oxidative damage, and its deficiency accelerates kidney decline. Eyes are the most obvious target. Low vitamin A causes night blindness, dry eyes, and a higher risk of diabetic retinopathy. The heart weakens as vitamin A is crucial for heart muscle function and blood vessel elasticity, making deficiency a risk factor for hypertension and heart disease. Mood disorders like anxiety and depression worsen as vitamin A regulates dopamine and serotonin pathways. Weight gain can become an issue because retinoic acid influences fat metabolism, and without it, the body stores more fat and burns less energy. Blood vessels become stiff and prone to damage, worsening circulation and increasing the risk of ulcers and slow healing wounds. Up to 30% of diabetics have low vitamin A, especially those with kidney disease or chronic inflammation at the cellular level. Vitamin A is a gene regulator, influencing insulin sensitivity, immune function, and cellular repair. It plays a key role in maintaining pancreatic beta cell health, helping the body respond properly to blood sugar fluctuations. Without it, cellular repair slows, oxidative stress increases, and insulin resistance worsens. For the best natural sources, beef liver is the ultimate powerhouse, delivering 149% of the daily intake per 3-ounce 85 g serving. Cod liver oil provides a massive 4,500 per tablespoon 14 g, making it the most concentrated source. Egg yolks offer 24% per 2 large eggs 100-gram, while butter from grass-fed cows gives 11% per tablespoon. 14-gram wild-caught salmon contains 25% per 6-ounce 170 g serving, making it a good source for those who prefer fish for the richest luxury meals. Fire with saffron infused cod liver sauce delivers over 5,000% proportion. 100 g FGR 14 g cod liver oil wagyu steak with bone marrow, butter, and egg yolk. Sauce provides about 1,500% per serving. 150 g steak 50 g marrow. 2 egg yolks. King crab bisque with wild salmon ROP packs 1,200% proportion. 150 g crab 50 g salmon are making it a decadent vitamin, a boost bioavailability, is highest in retinol animal sources, which absorbs at nearly 80 to 90%, while beta-carotene plant sources converts inefficiently with absorption rates as low as 3 to 6% in some people, especially diabetics with gut issues. The best supplements for diabetics are Carlson cod liver oil 4,500 IU per teaspoon and thorn vitamin A 3,000 IU per capsule. From retinol petat, both in highly absorbable forms, certain foods increase vitamin A deficiency, processed vegetable oils, high fructose corn syrup, and excessive alcohol all deplete stores if night vision is worsening, skin is dry, or infections are becoming more frequent. A vitamin A deficiency might be silently making things worse, and in fixing it could improve multiple systems at once. 2. Folic acid, or BN folic acid B9, is crucial for diabetics, but natural deficiencies happen more than you'd think. High blood sugar and medications like metformin lower folate levels by reducing absorption in the intestines and increasing urinary loss. Chronic inflammation from diabetes also disrupts folate metabolism, and oxidative stress depletes it faster than normal. Poor diet or conditions like kidney disease make things worse, leading to a persistent deficiency that goes unnoticed until symptoms start showing up. A lack of folate messes with almost every major system. Fertility takes a hit in both men and women. Low folate impairs sperm quality and egg development, increasing the risk of miscarriage. Libido drops because folate supports nitric oxide production, which is key for circulation, and arousal. Nerves suffer, leading to numbness, tingling, and even worsening diabetic neuropathy. Kidneys already struggling in diabetes decline faster, since folate helps regulate homocysteine, an amino acid that in excess damages kidney tissue. Eyes are at risk too. Deficiency accelerates diabetic retinopathy due to increased oxidative stress in retinal cells. The heart takes a major blow as homocysteine levels rise, leading to hardened arteries, high blood pressure, and a greater risk of stroke or heart attacks. Mood swings, anxiety, and depression get worse because folate is essential for neurotransmitter production, particularly serotonin and dopamine. Weight management becomes harder since folate influences metabolism, and a deficiency can lead to increased fat storage, blood vessels stiffen and weaken, making diabetes related circulation problems much worse. The percentage of deficiency varies, but studies suggest up to 40% of diabetics have low folate levels, especially those on metformin at the cellular level. Folate drives methylation process, essential for DNA repair, detoxification, and gene expression in diabetics. Faulty methylation leads to inflammation, poor nerve function, and faster aging of cells. FIDE also plays a role in red blood cell production, preventing anemia, which is common in diabetics with kidney disease. For natural sources, beef liver is king, delivering 54% of the daily recommended intake per 3,085 g serving. Dark leafy greens like spinach give about 33% per cooked cup, 180 gram, while asparagus provides 22% per cooked cup, 180 g. Avocados contain 20% per whole, fruit 200 gram, and lentils pack 90% per cooked cup, 198 g, making them one of the richest sources for top-tier luxury recipes with high fat content. FUA with truffle-infused lentil puree delivers over 150% purse, serving 100 g FGR, 150 g. Lentils Wagyu beef liver pate with avocado mousse provides around 120%. Proportion 85 g liver, 100 g avocado. A high-end spinach and asparagus soul with Gruyere cheese gives about 100% pres, serving to 200 g spinach, 150 g asparagus. These dishes maximize folate while offering indulgent flavors. Bioavailability varies. Folate from animal sources like liver is highly absorbable, while plant sources are less. So though cooking helps release more folate, the two best supplement options For diabetics are methylfolate 5, MTHF, and folic acid, both better absorbed than synthetic folic acid, the best available. Supplements are Thorn 5, MTHF 1 gram per capsule, and pure encapsulations folate 5, MTHF 400 micrograms per capsule. For diabetics, doses between 400 micrograms and 1 milligram daily are typically recommended, though higher doses may be needed for those with kidney disease or high homocysteine. Certain foods worsen deficiency, particularly alcohol, processed grains, and excessive coffee, which interfere with absorption. High sugar diets and oxidative stress from unhealthy fats also deplete fat faster. If energy levels are low, mood swings are worse, or nerve pain is increasing, a folate deficiency might be the culprit. Getting it under control could make a massive difference. 3. Iron. Although it's a mineral, not a vitamin, it would be unjust not to mention it with folic acid. Iron deficiency is common in diabetics, and it's not just about diet. Chronic inflammation from diabetes triggers PID and overproduction, a hormone that blocks iron absorption. Kidney disease worsens this by reducing erythropoietin, a hormone needed for red blood cell production. Metformin interferes with iron uptake, and frequent blood sugar spikes damage red blood cells, increasing iron loss. Many diabetics also have gastrointestinal issues like low stomach acid or gut inflammation, making iron absorption inefficient. Deficiency symptoms can creep up slowly. Fatigue is the first sign, followed by dizziness, pale skin, cold hands and feet, and headaches. Fertility suffers low iron, disrupts ovulation in women, and lowers sperm count in men. Libido drops since iron is essential for oxygenating tissues, including those involved in arousal. Nerves misfire, worsening neuropathy with tingling, numbness, or restless legs. The kidneys struggle more because low iron leads to renal hypoxia, damaging nephrons faster. Eyes become vulnerable. Iron is needed for retinal health, and deficiency can worsen diabetic retinopathy. The heart is at major risk since low iron forces the heart to work harder, leading to tachycardia, arrhythmias, and even heart failure. In severe cases, anxiety and depression worsen since iron is crucial for dopamine and serotonin production. Metabolism slows, making weight management harder. Iron supports mitochondrial function, and without it, energy production tanks blood vessels, weaken, increasing the risk of poor circulation, high blood pressure, and blood clots. Up to 30% of diabetics have iron deficiency, especially those with kidney disease or on metformin. At the cellular level, iron is crucial for hemoglobin, which carries oxygen to tissues. Without enough iron, cells suffocate, leading to fatigue, cognitive decline, and slower wound healing. Iron also supports cytochrome enzymes in mitochondria, meaning energy production in diabetics plummets when levels are low. For the best natural sources, beef liver is unbeatable, delivering 36% of the daily intake per 3-ounce 85-gram serving. Oysters provide 44% per 3.085 g, making them another powerhouse. Sardines offer 34% per can 92-gram, while grass-fed beef gives 22% per 3-ounce 85 g. Portion spinach, though plant-based, supplies 20% per cooked cup 180-gram, but its iron is less bioavailable due to oxalates. For the most iron-rich luxury meals, food GR with oyster reduction delivers over 100% proportion 100-gram F. GR 85-gram oysters. Wagyu steak with sautéed spinach and bone marrow sauce provides about 80% per serving 150 g. Steak 100 g, spinach 50 g, bone marrow. Mediterranean sardine and lentil stew with saffron pack 75% proportion 150 g. Sardines 200 g, lentils combining heme and non-heme iron sources for better absorption. Iron bioavailability is highest, and heme iron animal sources absorb at 15 to 35%, while non-heme iron Plants absorbs at just 2 to 20%, depending on gut health, and inhibitors, like Fate's vitamin C boosts iron absorption. So pairing spinach or lentils with lemon juice helps the best supplements for. Diabetics are ferrous bisglycinate highly. Absorbable iron by Thorn delivering 25 mgs per capsule and urine encapsulations. Iron C providing 15 milligrams per capsule with. Vitamin C for better absorption certain. Foods worsen iron deficiency dairy. Blocks absorption excessive coffee or tea reduces uptake due to tannins and processed grains strip away natural iron. If fatigue, brain fog, or increased neuropathy symptoms appear low iron, might be playing a bigger role then. Expected addressing it properly can be a game changer. 4. Vitamin B12. B12 deficiency is a massive problem for diabetics, and most don't realize it until serious symptoms appear. Metformin is a major culprit. It blocks B12 absorption in the gut by interfering with calcium-dependent transport, leading to a slow but steady depletion. High blood sugar and chronic inflammation damage the stomach lining, reducing intrinsic factor, the protein needed for B12 absorption. Kidney disease worsens this sense. Damaged kidneys struggle to reabsorb B12, causing more loss through urine gut. Issues like low stomach acid pylori, infections, and poor microbiome health further limit absorption, since B12 is only found in animal foods. Vegans and those with poor diets are at high risk. Deficiency is sneaky, showing up as fatigue, memory problems, dizziness, and nerve issues. Fertility takes a hit. B12 is crucial for sperm count, motility, and egg health, and low levels increase miscarriage risk. Libido drops because B12 is needed for red blood cell production, and without enough oxygen in the blood, energy and arousal suffer. Nerve problems worsen, accelerating diabetic neuropathy, numbness, and tingling. The kidneys struggle, since B12 helps reduce homocysteine, an amino acid that in excess damages kidney tissue. Eyes suffer too low. B12 increases optic nerve damage, blurry vision, and retinal issues. The heart takes a hit because elevated homocysteine leads to artery damage, heart disease, and strokes. Anxiety and depression worsen, as B12 is key for serotonin and dopamine production. Without it, mood disorders skyrocket. Weight issues arise because B12 regulates metabolism and energy production, and low S contribute to sluggish metabolism and fat accumulation. Blood vessels weaken, increasing the risk of high blood pressure, circulation issues, and blood clots. Up to 40% of diabetics on metformin have B12 deficiency, and those with kidney disease are at even higher risk at the cellular level. B12 is essential for DNA synthesis, myelin production, nerve insulation, and red blood cell formation. It also fuels mitochondria, meaning low B12 directly reduces energy production, making diabetics feel weak, foggy, and slow to heal. The best natural sources are beef liver, delivering 3,460 of the daily recommended intake per 3 ounce, 85 grams serving. The most concentrated source available, clams, provides 7,000% per 85 gram, making them another powerhouse. Sardines offer 557 per can 92 g, while wild caught salmon gives 208% per 6 ounce, 170 g. Serving eggs provide 23% per 2 large eggs, 100 gram, though their B12 is less bioavailable than meat sources. For the richest luxury meals with truffle infused clam butter delivers over 5,000% proportion, 100 g fire, 85 g clams. Ed steak with a caviar and sardine reduction provides about 2,000% per serving, 150 g steak, 100 g sardines, 30 g caviar. Lobster bisque with wild salmon roe packs 1,500% proportion, 150 g lobster, 50 g salmon roe, creating an ultra-rich B12 meal. B12 bioavailability is highest from animal-based sources, since plant foods contain none except For some unreliable fermented sources, methylcobalamin and adenoscobalamin are the most absorbable forms, avoiding the conversion issues of synthetic cyanocobalamin. The best supplements are garomethyl B12 5,000 micrograms per Laz, and pure encapsulations adenomethyl B12 1,000 micrograms per capsule. Diabetics with absorption issues often need 1,000 to 5,000 micrograms daily, especially if I'm metformin certain foods. Worsen B12 deficiency, excess alcohol, processed grains, and high sugar diets. Deplete stores, antacids, pies, and high-fiber diets can also block absorption if neuropathy, fatigue, or mood swings are getting worse. Low B12 might be the hidden factor, and fixing it could be life-changing. Summary: taking control of your vitamin levels can make a massive difference in your energy, nerve health, and blood sugar control. Most diabetics don't even realize they're running low until symptoms start creeping in, but now you know exactly what to look for and how to fix it. If this video helped you, hit that like button and let me know in the comments what you found most useful. And if you want more science-backed guidance on managing diabetes and preventing complications, make sure to subscribe so you don't miss out. Your diabetes health is in your hands. Small changes add up to big results. Take care, and I'll see you in the next one.